So, finishing up with chapter 9, musculoskeletal disorders. This one will be quick, try to jump around a little bit, but refresh on the muscular skeletal system. So, our skeleton wise and our skeletal muscles. Skeleton wise, all of our bones are classified anatomically as either long, short, flat, or irregular bones. Long bones being the bones that look traditionally like a dog bone. So your bones of your leg, like your femur, your tibia, fibula, your humerus in your arm, your radius, your ulna. Those kind of are long bones. Short bones are bones that kind of make up short and cube shape, make up most of your wrist and your ankle. Flat bones are flat bones like the bones of your skull are flat and thin. Your sternum, actually, your ribs, and irregular bones are more specialized. Your pelvis as a whole is irregular. Your coccyx, tailbone, all the vertebrae are irregular bones. And then the bone tissue is really made up of this matrix that kind of looks like it has a hollow cavity to it, almost looks spongy, like a sponge zoomed in on a microscope, but it's made of these bone cells called osteocytes. And they have some immature little brothers called osteoblasts and clasts. And they're about clasts are about bone reabsorbing or cleaning up. Bone producing cells or bone building cells are osteoblasts. And then bones typically work as a series of just you use some weight bearing exercise, the bones suffer little micro fractures, and then the osteoclasts declutter that, and then the osteoblasts lay down a new layer, and the bones are constantly doing a process called remodeling. And the more weight bearing exercise you do, and that can just be walking, the better the bones are off, and stronger they are. So types of bone tissue on the outside of most bones, you have something called compact bone, very tightly packed in like concentric rings or circles. And in the middle, you have what's called cancellous or spongy bone that is very much porous and has openings in it. Usually, that's also part of where the cavity you'll find like bone marrow in the long bones, mostly, and other bones packed in the spongy bone. And this is the marrow that creates red blood cells. Outside layer of bones called periosteum, inside the layer, especially the inside of what's called the medullary cavity, a big cavity filled with bone marrow in the compact or in the long bones. It's called endosteum. Periosteum is on the outside. This is a connective tissue that covers the outside of bones, helps them connect to the tendons and ligaments. Functions of our skeletal system pretty much facilitate body movement, maintain position, stabilize joints. The functions of our skeletal muscle are the same, basically: body movement, stabilization, produce heat, offer some protection. Our skeletal system's all about protection, and our muscular skeletal, so the muscles around the skeleton, are about movement and heat. For skeletal muscle, it usually falls under voluntary control in these concentric tubes of protein fibers. All about basically attachment points, directly connecting to that periosteum, or correctly tendons. Tendons will connect muscle to bone. Ligaments connect bone to bone. And typically, a lot of times in mitosis, they don't usually split. Muscle cells can enlarge and change shape based on how much they're used, but there's not like a total amount of new muscle that gets made all the time. That takes a lot of work. Skeletal muscles has nervous system control through a junction with neurons called a neuromuscular junction. That's why we get the voluntary control we get of muscles, because of their connection with the nervous system. And a chemical transmitter that's real involved, the neurotransmitter that's involved in skeletal muscle system is called ACH, or acetylcholine. And again, the goal is action potential arrives from the neuron, elicits a response from the muscle changes, flexes, changes shape, contracts, does the action we need it to, and then relaxes into a flaccid state. Our joints are connection between bones. Usually their joints are filled or accompanied by connection to muscle and connection to other bones. So tendons are connecting muscle to bone, and ligaments connect bone to bone. And there's usually a limited blood supply in these joint capsules. And so joints injuries always tend to have poor healing or slow healing because of the limited blood supply. So classification, there's a few different types of joints. They fall in the category of synarthrosis, also known as fibrous, amphiarthrosis, also known as kind of semi-movable, and diarthrosis. Excuse me. Diarthrosis is also known as synovial joints, very freely movable. So synarthrosis are like where your skull bones connect. They're not really moving a lot. Amphiarthrosis is like your ribs and the sternum. Your rib cage can do some movement, not a lot. It's pretty fixed, but it will move in and out with breathing, that sort of thing, some flexing to it. And diarthrosis are the freely movable, also known as synovial joints, your shoulder, your hip, your knee, all these really freely movable joints. So each joint, and we'll look at a picture in a second, has cartilage on the end of each bone, and usually there's a membrane around the joint kind of encapsulating it. There may be ligaments that connect the bones, two bones together to help keep them straight. Also, in these synovial joints, these freely movable diarthroses, they'll also have sometimes these small sacs called bursae. Bursae produce synovial fluid. Most of these joints are encapsulated with fluid in them to allow frictionless movement, to allow the movement to not provide friction or injury. So you can kind of see here that two bones are meeting and they have cartilage on the end of them to provide, if contact, they have smooth movement. The joint cavity is encapsulated, filled with different tendons connecting these guys, and then a fluid to make the capsule move and the bones move over top each other efficiently without causing injury. Diagnosing muscle disorders, obviously x-rays is somewhat some of the kind of gold standard, but you can also look at others more specific. There's bone density scans and stuff like that to look at the density of bone, and MRI to get more exact. If there's joint problems, there may be drainage of that synovial fluid to assess that fluid and see what properties it has. So fractures, some of the fracture stuff needs to know. What is a fracture? Fracture is a break in any bone or loss of integrity. Fractures could be trauma. They could be related to neoplasms like tumors and cancers, disease processes, or increased stress on the bones, physical. Classifications: complete. This is where the bone is completely separated in two pieces. Incomplete is the bone is only partially broken, sometimes called a simple fracture, or sometimes called a green stick is an incomplete fracture. Open, or sometimes called compound fracture. That's a big one to know. A compound fracture is the bone is completely broken or partially broken, but it pierces the skin. And if a bone pierces the skin, the biggest risk is, well, damage to surrounding tissue. For one, damage to blood vessels, surrounding tissue, but also infection, because our skin is, our primary protecting layer. And so we break that with a bone. Now we have free access for microorganisms to make their way towards our interior, and could lead to bone infections, that sort of stuff. Simple is a very small break. Single break, one line where the bone maintains its alignment and position, just a small crack. That's simple fracture. Comminuted fractures are multiple fractures where the bone fragments into pieces and splinters. That's comminuted. And compression is very similar, but usually related to how it's cracked. Bone is like crushed or collapsed upon itself, and in small pieces as well. And you'll see compression fractures more in line with vertebrae, stuff like that, from falls or severe, construction injuries, stuff like that. So this is some. There's some ones that are not communicated. You can see it's a fracture, multiple pieces, open, the bone is protruding. Pathological, it's a decent one to highlight here. Pathological fracture means a fracture due to some other disease process, a bone tumor, bone diseases that cause fractures. It's not really, the bone wasn't physically altered, it was fractured because of the disease process. Spiral, oblique are all kind of very similar. Transverse, pretty standard. Green stick is what I talked about, was a simple fracture. Impacted, compression fracture. These are just showing you some of the images, but I think that list previously would be your best. Knowing this list previously is your kind of best bet, basically, to highlight these guys effectively. Pathology behind it. Think about with bone fractures, a big thing to think about is our body's initial immune response is going to kick on. And so there's going to be bleeding, edema, release of the bradykinin, so causing pain. Blood clots will form. Other just systematic signs of inflammation and injury, swelling, all those redness, increased warmth. For healing, our bones want to do a hematoma, and they're going to connect with a fibrin mesh. And they're going to form around the injury. And then eventually the bone cells will get in play, break down all of the fractures of bones and try to rebuild the bone and generate new bone. Sometimes there's calluses or remodeling that happens where the bone builds up bigger and thicker than it was before. And this is just in response over time that tends to go down. But sometimes if multiple fractures to the same bone or something like that, bone will build up and kind of stay there. One other thing to note about fractures is compartment syndrome. Compartment syndrome is basically the edema gets so bad that it has nowhere to go. If around the connective tissue surrounding the bone of edema and swelling gets so bad that they're pushing against the skin and there's nowhere for that fluid to go, it could cause suppression or depression on blood vessels, nerves, and other stuff, and cause decreases in lack of blood flow and further tissue injury. So compartment syndrome knows by like intractable pain. Usually you'll know compartment syndrome because they'll lose a pulse to that extremity. There'll be extreme swelling. They'll have pain that pain meds don't work on. Um, and the best way they can correct this is they have to do a fasciotomy. They have to cut part of the skin open and let that pressure out. You can also see compartment syndrome with too tightly wrapped wraps or casts can cause compartment syndrome, and it can lead to dead tissue, gangrene, even amputation. So you want to kind of stay on top of this when people have a loss of pulse on the extremity and intractable pain with huge amounts of swelling to a broken bone. Then you're worried about compartment syndrome. That's a need to know. Dislocation just means the two ends of distal ends of the bone have separated from themselves in a joint. Usually there could be definitely tendon and ligament damage in this situation. And if it keeps repeating, there may be surgery to kind of fix it in place and that sort of stuff. But this is the most common dislocation joint is usually the shoulder because it's highly movable and it's easy to fall on and that sort of stuff. And what's not shown in this picture is that the humerus is probably still connected to part of the scapula and clavicle via its tendons and maybe ligaments. And so other muscles are in play. So could be injury to those and it needs to be put back into place. And you can set that in the field. It doesn't have to be surgically repaired. But it takes a trained hand to do that, and it's painful. Sprains and strains. Sprain is usually a tear in a ligament, which is ligament again is what connects bone to bone, and a strain is a tear in a tendon, and they can happen at the same time. Avulsion is rare, but it's where the tendons or ligaments completely separate from their attachment points. And usually, again, with any injuries, strains, sprains, and even bone fractures, immobilization is usually to prevent further tissue injury. So, setting the bone, if a bone fracture, the bone has to be set back to alignment. And maybe that has to be done surgically, but not always. And then the bone needs the time to heal, and the time to heal is not using it. So, immobilizing it. So, cast, splint, slings, whatever it takes to keep the bone immobilized and the injury immobilized. And that goes for kind of really any injury, sprains, strains, broken bones. Also, you can have muscle tearing. So this will come from overextension or overstressing the muscle to that point, and that can happen with skeletal muscle as well. And that's not too big of a deal, but a lot of times you'll get some scar tissue that replaces it. Muscle function might be lost, that sort of stuff, permanent muscle loss. So some bone disorders, one of the big ones that we talk about a lot is osteoporosis. Osteoporosis, also known as porous bone, it kind of means like holy bone. Usually occurs, this is a disease that decreases bone density and mass, basically. So abnormal shape of the bone or bone functionality decreases. Basically, what happens in osteoporosis to make the bone porous and more brittle is another term they use to describe osteoporosis. Brittle bone is bone reabsorption. So bone kind of destruction and utilizing the chemicals of calcium and phosphorus exceeds the new bone formation. The reason this would happen usually is loss of density based on, and you would see multiple fractures usually with osteoporosis. And this would be technically a pathological fracture, especially if there was no force applied to the bone that would normally cause an injury and it happens to be a fracture, that would be pathological. You see that commonly with osteoporosis, and it's because the bones are just more brittle. We need weight bearing exercise to effectively generate new bones. It's the process is called bone remodeling. So if I do some light weight bearing exercise, which I'm talking about, walking, something like that, it puts a little bit of strain on my lower leg bones, and they will have little micro fractures. And so the bone osteoclast will come and declutter that up, clean that up, and then the bone blast will come back and rebuild a new layer of fresh, strong bone. But if I'm not doing the weight bearing exercise, it tends to be that bones tend to get reabsorbed, and the osteoclasts tend to be working harder than the blast, and there's never really a lot of new bone built. And then you get these porous, brittle bones. You'll see conditions of abnormal spine curvature like kyphosis and scoliosis with this, maybe even lordosis. And these are just because the vertebrae bones are becoming weaker and brittle. Usually, what makes it, there's hormone factors involved, lacking in vitamin D and calcium, because calcium is the main mineral we need for bone development. But again, the big things is age, um, higher incidence in women, and decreased mobility, and sedentary lifestyle. Cigarette smoking plays a factor. Small bones and frail people play a factor. Smaller, just individuals. Excessive caffeine takes a factor as well. But age, female, decreased mobility, and usually your big signs of osteoporosis development. Osteomalacia, won't spend too much time on it. This is a condition where it's more involved with vitamin D and dietary deficiencies that mean calcium's not being deposited in the bones efficiently, seen in some children. And it has the same kind of symptoms of small, like soft bones and compression fractures. Osteomyelitis, I would say, is a need to know. Osteomyelitis can come from any fractures, but it's basically osteomyelitis is a bone inflammation and bone infection. Typically, when people talk about osteomyelitis, they're definitely talking about bone infections. So fever, excess sweating, chills, general malaise, all the normal high fever or all the normal infection symptoms, but it's of the bone, which is bad because bone has bone marrow and has a lot of blood supply. And it means that a lot of potential for this osteomyelitis to turn into sepsis, turn into bacteria or organisms, infectious microorganisms in the bloodstream, which is bad news because then they can get anywhere. So osteomyelitis is a big deal. Typically, you'll see this common come from people that have skin injuries like venous stasis or arterial ulcers around bony prominences, around the coccyx on the back, for pressure ulcers, around toes for arterial ulcers, and that wound could get infected and be close proximity to the bone that could lead to osteomyelitis, which is a bad deal. The abnormal curvatures of the spine that you might see with something like osteoporosis, kyphosis, and lordosis are more common. Scoliosis is definitely more in line with diagnosed usually later, early adolescence, or at birth. But kyphosis is an abnormal curvature of the thoracic spine here, where it starts to lean backwards and makes the head lean forward. And this is common as the vertebrae weaken. And then lordosis is much more associated with like lower back injuries where the spine, lumbar spine, the lower part of the spine starts to push forward. But they're abnormal curvatures of the spine. Muscular dystrophy, I won't spend too much time on this. It's a recessive disorder, basically affects skeletal muscle. Duchenne's or Duchan's, the most common, and affects younger boys. It usually leads to bad waddling gait, issues climbing stairs, issues with mobility, motor muscle weakness, reflexes depressed, and could lead to respiratory and common cardiac issues. Diagnosing things like this is usually genetic testing, biopsies, that sort of stuff. Some of the joint disorders that are worth highlighting for us is osteoarthritis versus rheumatoid arthritis. So osteoarthritis is known as the wear and tear arthritis. It's degenerative, meaning over time. So basically, if I'm in the military, or I do a lot of things involved around I do a lot of work that involves weight bearing exercise, military, jumping on a plane, smashing my hips and knees a lot when I land, that sort of stuff. Um, there's a genetic link identified, but overall, it's usually just wear and tear. So it's just over time that articular cartilage, that cartilage on the end of long bones of the joint, gets damaged repeatedly over like repeated physical activity or abuse. And that surface becomes rough, and that cartilage doesn't really regrow. And remember, it's got poor wound healing because joints have poor perfusion. Um, and usually it kind of accelerates the cartilage wears away, makes the joint wear on itself, maybe even to bone on bone where bones are rubbing against each other. And that will cause bone cysts, that will cause bone spurs to develop, and inflammation around the bone causes a lot of pain with arthritis. So again, the primary usually is related to weight bearing activity, age, obesity. Being more weight on the joints is effective. So it affects the fingers, hands, arms, shoulders, hips, knees. Going to have aching pain with movement. Walking becomes difficult and could even affect jaw and speaking and chewing, any joint you have. There are, for the big joints like the shoulders, hips, knees, we can do joint replacement to improve quality of life, because kind of once it's done, once arthritis has eaten away, that's what arthritis means. Arthrosis means joints and itis means inflammation. So arthritis just means inflammation of the joints. Then there's not really much we can do. We can't replace that cartilage necessarily, but we can replace the joint with a synthetic version. Rheumatoid arthritis is considered an autoimmune disease. Mainly affects the same, basically it's the same symptoms. It's the cartilage of the joint gets eaten away, kind of part of this rheumatoid factors, a link to it. It's a systemic inflammatory response. It's also been linked to lupus, higher incidence in women, and inflammation around the joints. Cartilage erodes and causes bone issues, causes some deformities. It's an exact cause. There's a family and genetic component, and there's some links to viral infections, but it typically affects the hands, feet, joints, and just joint stiffness, pain. And there's not a lot of treatments either for it. Gout also can cause arthritis, but gout is basically in the joints deposit of uric acid, or uric acid crystals, they would call them, and basically forms these hard nodules around the joints, causes a lot of local inflammation, and kind of has attacks, basically has these exacerbations like flare-ups. Causes a lot of inflammation, redness, damage to the joint. Another inflammatory joint thing to think about is tendonitis. Tendonitis just means inflammation of the tendon. This usually usually manifests itself as limited movement, pain around a site, a joint site, but usually diagnosed with just a physical exam. And we use kind of anti-inflammatory drugs, usually NSAIDs, and physical therapy to kind of treat it. That depends. Also reducing the way we do stuff. You might see tendonitis kind of in the form of repetitive injuries and that sort of stuff. And that wraps up everything for patho in the last two chapters that you'll see heavy on the final. Definitely chapter 16 and a lot of diabetes, but that wraps up everything for pathophysiology. Thanks for listening. You guys have a good one.